Let's speak with Christine Monduate. I understand you've been to all the states in the country in the fight, to ensure that malaria is completely eradicated. Tell us what you know. What really are the issues? Why is it a difficult push?
Yeah, well, I think there are many factors that are contributing definitely to this problem. One of them, of course, is the natural conditions of the country. This is climate driven. We have several floods in different parts of the country every year. So that's one. The sanitation conditions is another one. This is where you have the mosquitoes reservoirs, of course. But also there is a lack of understanding and information on how to have preventive measures. So although everybody knows there is malaria in the country, and I think there is not one community in the entire country that doesn't have cases of malaria, and definitely deaths, mainly children, because they are the smaller, the more vulnerable population in the country. Despite all this, the preventive measures that should be practiced by families, by communities, are still not there. The other factor is economical means, the high poverty conditions in several households in the country. At times they really don't have the means to get the mosquito nets. Of course, despite the efforts of the government, who always is trying to provide these type of supplies and commodities as much as possible. And so that is one, adequate mosquito nets with spray with insecticides. This is one of the most important preventive measures if you are in a malaria context. So this is one. You mentioned already the vaccine, but the vaccine, of course, we all have high hopes, and here we work together with the Ministry of Health and the malaria program, also at state level with the majority of the state ministries of health. I am happy to see the Commissioner of Health of Bayelsa connected, because we spoke about malaria, I think it was 1 year ago when I was there. Yes, the malaria vaccine can be a huge, important response, but it's still on its pilot stage. So that means we all should be alerted, and we all should use our preventive measures. First one, of course, the repellents that are available, although there is already some resistance to repellents, but despite that, we should try some measures about how to manage your households, right? And not really open doors. Avoid having, the water there just deposited without not really taking care for it to be washed away. Okay. And the other one is the mosquito nets.
Okay, tell us specifically the programs and initiatives UNICEF is implementing to support malaria elimination efforts in Nigeria.
So I would name 3 or 4 main ones. One is that we work closely with the federal ministry and at state level with the commissioners and the state ministries in building capacity, mainly also in supporting the primary health cares and community health workers in providing preventive messages to the people who attend to these health facilities. Second, we contribute to the country's efforts in the campaigning and awareness raising. So we always speak about awareness raising, but in other words, for all the people that is watching this program, awareness raising is having the enough information for you to understand first, the seriousness of the problem, and second, how to prevent it, and third, how to have curative attention in health in case you already got the malaria. So that's the second point, information and social mobilization. Third, UNICEF supports with the procurement. I'm not saying the funding, the procurement we support because the funds come from the national budget. We support with the procurement of the vaccines, and in the case of malaria, the whole idea with our procurement service is to bring them, to support them, to distribute them. And finally, our teams in the field help as well the national efforts in terms of the monitoring, right, of this. So the vaccines, as the doctor said, are now in Bayelsa and Kebbi. And well, we hope that, the country can have the opportunity and the funds as well to increase. Now, what people need to know is the malaria vaccine is a 4-dose vaccine. So if you only go once, it's not enough, right? And one of the things we are now analyzing is that, yes, people go, they take it once and they don't return, so there's a lot of dropout. Now, the problem with this is, first, you are not really fully immunized, but second, there is a lot of vaccine wastage. Vaccines that are costing the people, the government of Nigeria, a lot of resources. So whoever goes to take the vaccine, you need to be responsible enough to go back and finalize your treatment.
All right, I'd like to stay with you because you talked about the vaccines, and tell us, what's the quantity Nigeria has received so far? Because there's a report that says it's just been 1 million.
Yes, yes.
1 million doses.
Provided by Gavi. Gavi is one of our main partners in the vaccine distribution and provision to countries. Now, yes, I mean 1 million sounds a small quantity in a country of 220 plus million inhabitants. But the point is, this is a new vaccine. So it is not that, Nigeria doesn't want to get a major volume of vaccines. It is globally the availability of vaccines because it's new.
Okay, Dr. Shekarau, you are the